Let's discuss about the Palatal Canine Retractor today. So generally palatal canine retractors are used in pushing your palatally placed canines. When you want to push the palatally placed canines a little distally, you can use a palatal canine retractor. It's adapted to the palatal surface. So now after incorporating some cold working in the wire by straightening it, I am trying to adapt the active arm. So the active arm is basically like I'm going to try to push the canine distally. So the active arm should engage the canine from the mesial end so that when I incorporate force, the canine can be pushed more distally. So now that I have adapted the active arm, the next step will be placing the coil. So one important thing in springs is that the coils should always be right angles to the direction of the tooth movement. So which is basically I'm going to push the canine distally. So my coil should be facing mesially. So now that I have placed the coil, and the coil, you have to make sure that the coil is along the long axis of the tooth and at right angles to the direction of your tooth movement. So the prime purpose of incorporating a coil in any spring is to increase the length of the wire so that there's an improved range of activation when you are using the canine retractors for pushing the canine distally. So now that I have placed the coil and the active arm is also ready, now I have to focus on placing the retentive arm. So in order to do that, I need to mark it along just 2 mm beyond the gingival margin, and I'm going to give a 90-degree bend. So I'm giving a 90-degree bend here. So again try to adapt it on the surface of the palate. So there must be sufficient length from the canine so that I am able to incorporate all of this inside the acrylic later so that doesn't displace off from the acrylic. So make sure it's well away from the cervical margin. So now it's adapted to an extent. So again I have to give a 90-degree bend from this wire to bring out the retentive arm, which is to be adapted to the palate. So I'm giving a 90-degree bend straight. One important thing about palatal canine retractor is we need to incorporate sufficient length into the retractors, and so be very careful when you're cutting the wire. When you're make sure you take sufficient length of the wire. So if the wire becomes short midway, then you have to repeat the whole process again. So the next process is I'm cutting the wire of sufficient length so that I can adapt it better. If the wire is too long, I'll not be able to adapt it to the palate. So I am cutting it to the extent that I require to put the retentive tag now. So putting the retentive tag is very important in any kind of wire bending, any removable appliance, because the tag it acts as a source for incorporation of the acrylic. So later when you're acrylizing it, this will play a major role in retaining the springs within the appliance. So now that I put the retentive tag also, you can see it's away from the canine and it's away from the cervical margin. So I'll have sufficient space to incorporate the acrylic. And now when I've adapted it to the final thing, you are able to see that my active arm is not adapted correctly. So I'm adjusting the active arm to adjust to the height of contour of the canine. So it should be contoured to the height of the canine. It should be adapted nicely. So when I activate it, I can push the canine distally. Thank you.